talk about assist control mode or AC mode. AC mode is a ventilation mode where the ventilator provides full support for every breath, whether the breath is initiated by the patient or by the ventilator. So how does AC mode work? If the patient initiates a breath, the ventilator detects the patient's effort and deliver a full preset tidal volume or preset pressure in pressure controlled AC. Even a small patient effort result in a full ventilator breath. If the patient does not initiate a breath, the ventilator delivers breath at the set respiratory rate. Therefore, the ventilator assists when the patient tries to breathe and controls breathing when the patient cannot. Hence, the name assist control is made. So, when is AC mode is used? It is used when there is weak spontaneous breathing effort, semi-conscious or fatigued patient, early phase of mechanical ventilation, respiratory distress or unstable breathing pattern to ensure adequate ventilation with minimal patient work. So, let's talk about advantage of AC mode. It reduces the patient work of breathing, ensures consistent tidal volume with every breath, stabilizes oxygenation and ventilation, good for initiating mechanical ventilation. And lastly, let's talk about the drawback of AC mode. So the drawbacks are, if the patient rapidly breathes, the ventilator gives a full tidal volume with each breath, which leads to hyperventilation and respiratory alkalosis. Second drawback is risk of barotrauma or volutrauma, because every breath is a full mechanical breath. Last drawback is sensitive triggering issues can cause auto-triggering, leading to excessively high respiratory rate, which again leads to the hyperventilation and respiratory alkalosis. As we discussed earlier, in mechanical ventilation, you can control either volume or pressure, not both at the same time. So in AC mode, you can have volume controlled AC, VCAC, and pressure controlled AC, PCAC. Usually volume controlled AC is preferred, but in some patients, we switch to pressure controlled AC. So in VCAC mode, the volume is fixed and the pressure is decided by the ventilator. Sometimes to deliver that fixed tidal volume, the ventilator needs to apply very high pressure. This results in high peak pressure alarm. So if the alarm ring, it indicates the increased risk of the barotrauma and possible alveolar injury. The ventilator essentially warns you set a constant volume. I'm trying to deliver it, but I am being forced to generate too much pressure to push this volume into the lungs. So what should you do if you see a high peak pressure alarm? Always assess from the ventilator towards the patient. High peak pressure may occur because the ventilator is fighting against obstruction or resistance. The common causes of obstruction or resistance are secretions or fluid in the ventilator tube, blockage or kinking of the ETT tube, patient chewing the ETT tube, bronchospasm or airway narrowing, thick secretion in the patient's respiratory airway. So we have to look for all these essential signs in the AC mode. In summary, if you see high peak pressure in AC/VC mode, check the ventilator circuit for water or blockage, check ETT tube for kinking, biting or mucus plugging, check for bronchospasm, suction the patient if needed, evaluate lung compliance,